We talked over here about how all of this vascular response, over here that's happening, and all these pro-inflammatory mediators that are being released all here, and the fact that all of that blood is being pushed out into the tissue, and how that makes the blood inside the vein viscous. Part of that is, yes, this nitric oxide that's released during phagocytosis. We're going to talk about that in a minute. The nitric oxide from those pro-inflammatory markers and so on. So when you see nitric oxide come up, sorry guys, I know I have a better spot here. We talk about nitric oxide. Again, I've kind of shown you where it's coming from. I've moved that kind of blood over here so that we can talk a little bit more about it. So again, I've drawn this kind of cross section of the venule. Okay, so this is the endothelium. This is the inside of the venule. So you remember that through chemotaxis, right, which is the calling of those white blood cells by prostaglandins and leukotrienes and what have you, histamine and what have you, those white blood cells have been called to the area of injury. But what happens is white blood cells tend to hang out in the center of the venule. We call them axial. They're axial white blood cells. And what that means is, you could see in this picture here, they're all kind of hovering, in the middle here, right? And so what's really cool about this viscous blood, this whole idea that the blood has become thicker. So that blood flow through the area has slowed. It's become viscous. So you've got a higher amount of red blood cells kind of in here, right? What happens is those red blood cells push the white blood cells to the sides, okay? They push them over to the sides like this. And when they do that, we call that margination. I'm going to go through this again, so don't worry, but that they push them to the sides, and we need them to the sides because your injury, your injury is out here, right? So we need to get these white blood cells out into the tissue. Definitely not going to happen if they're hovering in the middle of the venule like this, right? So now the white blood cells the red blood cells that have accumulated there through the buildup of nitric oxide and through the fluid being pushed out, have now pushed these white blood cells to the edges. So they're all sitting kind of here now. They're marginated. And then you can kind of see, I really like this drawing. This is kind of showing you that here. So here's your axial white blood cells. Your white blood cells are stuck in the middle of the tube like that. Okay, you've got this increase in white blood cells, or red blood cells, because of the nitric oxide and the viscosity and all that we just talked about. It's pushing those white blood cells now to the sides. This is called margination right there. It's called margination. But now we need to get that blood out. And so we need it to go, I'm going to skip these two phases for a second, okay? We need it to go through, remember those gaps we made in the capillaries earlier? We need those white blood cells to go through those gaps and out to the tissue, out to that site of injury, right? So how does that happen? This is where things do get a little bit confusing. I'm going to try to break it down as simply as I can. Those cytokines, there are cytokines that are released during the initial inflammatory process, okay? I know the word cytokines hasn't come up yet, so it seems like it's coming out of nowhere, but they've been, throughout this entire process that we've been talking about, we just haven't mentioned them, but they've been being created and being released. Cytokines, you don't need to know their names. They're things like interleukins, tumor necrosis factor. These are all they're very important parts of the inflammatory process, but they all kind of have their own little role. And thankfully, you don't have to memorize them all. So all you really need to know is the word cytokines, and that they are molecules or parts of the inflammatory process. Okay, those cytokines, part of what they do is they cause the white blood cells to express or create these things called cellular adhesion molecules. And so what those are is, let's say this is your white blood cell here, okay? You start to express or create these little molecules up on the side of the cell, like so. But it also creates or expresses those molecules. So that's the cell, right? This is the vein. It's inside of, like, it's inside the vein. Sorry, I'm not an artist. So it also will create those molecules here on the endothelium of the venule. These, again, are selectins and integrins, or cellular adhesion molecules. Okay, what those cellular adhesion molecules basically do is they cause the white blood cell to become sticky and to stick or adhere. That's why we call them adhesion molecules, or adhere to the endothelial wall. So if you scroll down here, remember we talked about, okay, the white blood cells have now been pushed to the side, or margination has occurred. How do we get them out of these gaps into the tissue? That's where these selectins and integrins play a big role. If you look down here at this kind of little drawing here, you can see this. Say this is your little neutrophil here. You've got these selectins and integrins. Or let's say selectins first. Kind of pull it to the side, and then so as you get here and here, attracted here and here, right? It rolls. This white blood cell rolls, and it keeps rolling and sticking and rolling and sticking and rolling and sticking, and then it kind of flattens out a little bit, and that's how it finds its way through that gap in the endothelial layer that we talked about earlier. So that's kind of I feel like the selectins and integrins and that rolling and margination is really the most confusing part. So if you can kind of get a handle on that, you're doing really well. The other thing I wanted to highlight is that this process of those white blood cells escaping through those gaps is and moving to, let's say, the site of injury is here, and moving to the site of injury. This whole process of going through the wall and to the injury is called diapedesis. Okay, it's a part of extravasation. Extravasation just means outside of the vein, right? So it's moving outside of the vein. I think your slide also called it emigration, right? It's part of the emigration of the white blood cell. They're all kind of referring to the same thing. It's just that diapedesis and margination are just really more specific to those specific aspects of emigration or extravasation. So again, you've got your margination, which is the pushing of it to the sides, and then your diapedesis, which is it going through the gap and out, through the gap and out to the site of injury.